Well, thanks so much for being with us today. I'm Jaya Lent with Generations United, and I'll talk a bit about our organization in a minute. And I am joined, I'm the Deputy Executive Director there, and I'm joined by Bette Hoxie and Victoria Gray, who are both members of our Grand Voices Network and caregivers for children. So I want to just start by telling you a little bit about Generations United. Our broader work focuses on promoting intergenerational programs and policies, but we're home to the National Center on Grandfamilies. And that center does work in a lot of space. We do federal policy advocacy. We put together resources and information and tools and raise awareness about grandfamilies with the broader media and public. But our work is really driven by our Grand Voices Network, which currently has caregiver advocates representing 45 states and 11 tribes. So we really have moved to a model where the work we do is driven by the recommendations, the desires, the information that we get directly from caregivers across the country. As you're listening to the presentation, we know we want this to be interactive, so I ask that you be thinking about, as we're presenting, what surprises you most, what stood out as a strength in terms of this presentation, are the caregivers, as we talked about, caregivers and grandfamilies, and what's most compelling, or what here really inspires you to ask. So just be paying attention to that as we talk through this today. A bit more about our Grand Voices Network. As I mentioned, the goal is really for their voices to be front and center. Here's just a snapshot of some of our caregivers in addition to the voices that you hear today. And we really elevate that, that their voices are driving our work. In terms of grandfamilies, when we're talking about grandfamilies, we are talking about grandparents or other relatives who are raising children and the children that they're caring for. Grandfamilies happen for a number of reasons. Some of them are on the screen. We see that, parental substance use, death, disability, military deployment, parents who are incarcerated, and most recently we've seen loss of parent because of COVID-19 causing the creation of grandfamilies as well. We also see the child welfare system relying really heavily on relatives when children can't remain with their parents. A third of all children placed in foster care because of parental substance use live with relatives. So particularly when it comes to substance use, there's a strong reliance on relatives to care for children who can't remain with their parents. Just a quick snapshot on the data. We are seeing increasing numbers of grandfamilies, and there's different types of grandfamilies, or they're referred to in different ways. That biggest number, 8 million, is the number of children that are in households headed by a relative, but the parent may or may not be in the picture. The 2.7 million are those children being raised by a grandparent, relative, or close family friend, but the child's parent is not in the home. So we feel very confident in that case. Those are, grandparents that are really grandparents or other relatives that are full-time responsible for the children. And then that smallest number are the number that are in foster care with a relative. So that means the foster care system has legal custody of those children, but that the relative is providing for the day-to-day care. And I emphasize that because that number is much smaller, and that is the population that's much more likely to get support, financial or other supportive services at a much higher level if they're in the foster care system. It also comes with a number of complexities and structure that you don't get if the children are outside the system. But it's important from an economic security standpoint because they're much more likely to get the full foster payment. They don't all, but they're more likely to get the full foster payment. Whoops, 1 second. There we go. In terms of the data, we do have some data on the grandparents who are responsible for the grandchildren. You see about 19% live in poverty. They are raising their children for extended periods of time, nearly half for at least 5 years. Many are still working, but we do have about a fourth that have a disability, and many are older, nearly half are 60 and older. And again, I emphasize that for every one child that is in foster care with a relative, there are actually 19 outside of foster care with a relative. And that is the group that's less likely to get financial support and other types of support. We do also see racial overrepresentation in grand families. Particularly, there's larger numbers of African-American grand families, which in some ways parallels the disproportionate number in foster care. And American Indian, Alaska Native families are also overrepresented. And I flag that because it really has implications when we're thinking about just and fair policies. We want to recognize that we need to be supporting these families on a number of fronts, but when we aren't, it really is a racial equity issue as well. And then when we talk about families, we always want to emphasize, of course, the strengths. There is very clear research that when children cannot remain with their parents, that they do better in relative care when compared to how they do in the care of non-relatives. So we see that they have better behavioral and mental health outcomes. They're more likely, that relative home is more likely to be their permanent home versus moving from place to place, so more stability. They're more likely to stay connected to brothers and sisters and to their cultural identity. And this last one is a big one, just a stronger sense of belonging. There's actually research that shows that children in relative care are more likely to say that they always feel loved. I think to that point, a quote that really highlights that, I think, to so many people, and this is from one of the young people in one of our grand members' households. Most people go to grandma's house and get spoiled. But for me, it was the only safe place I had. Getting to live with grandma was like going to grandma's house all the time. I had more love there than anywhere else in my life. And to just illustrate a bit firsthand about a story of a grand family, you all are in for a treat that you get to hear directly from two wonderful people today. And I'm going to start with just asking Miss Victoria Gray to share a bit about her experience as a grandparent caregiver, also has been a foster parent of so many children. So Victoria, I turn it to you.
Good afternoon. Thank you so much, Dara. My journey is very long and detailed, but for this, I will shorten it for you. Our first grandchild came to us in 1993 before the words kinship or grandfamilies even existed. My husband and I were both working, but I had to stop working to care for my granddaughter who was born medically fragile. She had a lot of things going on. So immediately we had a reduction in income. We were fine, we were comfortable, but the loss of a salary really, created sort of a hardship. My day was then spent a lot with taking my child to the doctors, cardiologist and neurologist. She had a lot of things wrong with her. But even moving forward, she had a brother that came to us 6 months after we took her in. So this created other things for my husband and I, because now we're having to spend money like we didn't have the extra money now, and we had to research for services and resources. And in 1993, there weren't a lot of those things there. So we struggled really a lot. In the long run, we tapped into our savings account. We tapped into our 401. We maxed out a credit card, all of these things, because family means so much. We were not going to just let our granddaughter and grandson be anyplace else but with us, even though it was a hardship with all of the medical things that were going on with them. It meant a lot to us to know that they were safe and that they were with us. So many families that I've even talked to in support groups, because that was a lifesaver for me, have some of the same stories. A lot of them, some single grandmothers who were working that now cannot work. The financial hardship and struggle that it caused for the family still does not outweigh the fact that we will take our children in and provide love and support and safety for these children. So over the years, it's we wound up taking in 7 grandchildren. We are down to the last 2 who are 17. My husband is 84 and I am 70, but we're still hanging in there doing what we need to do for these children. And we just know that when we retired, we discovered Medicare did not have a family plan. And it was, the amount of money that you get from Social Security was geared to help one person. Our combination was enough for two people, but then we turned into a family of nine overnight. So it's very important that we look at some of the backgrounds of the families that are taking in the children, not just place the children with them, but we need to kind of take a look at what the financial situation is of these families because we are there giving almost 50% of support to all children that are in foster care. But yet the services and things are not there for informal families, and those are families that are not connected with the state as they are with those that are connected with the state. So it takes a lot to raise the children. COVID has caused a lot of families to become grand families because of the death of the biological parents. And sometimes people are not financially ready for that. And during this time where so many people are unemployed, have lost their jobs and in the process of being evicted and these type of things, we still will not just give our children away. We will do whatever we have to do to take care of them, even though it's a large financial hardship. I would not have it any other way than to have my children with me, my grandchildren. And in the picture, that is actually a great granddaughter. So her mom was my granddaughter, and I raised her mom, and she's just the love of my life, and I can't see it any other way. But I enjoy speaking to people because I want you to understand that we do this for the love of the children, and a lot of us are struggling financially, poverty level at most of the families. But we just want to make sure that everybody understands that we do it because we love the children and we're asking for assistance. We're asking that someone give us some resources and services so that we can help to make these children's lives and great and make them to become better citizens. So I thank you. And if you have any questions, I'll be more than happy to answer them.
Thanks so much, Victoria. And we will move through a few more slides and then Bet will talk and then we will open up time for questions then. Okay. So feel free to put questions in the chat at any time, but we will pause for questions then if you want to still sort of gather those together. Thank you so much for sharing, Victoria. Always really powerful to hear about your experience. And I want to acknowledge also that Victoria, after taking in relative children to care for, also became a foster parents to unrelated children, and want to acknowledge that you got financial support for the unrelated children, but perhaps not the equal support for the children that related to you.
Yes, it was a little alarming in the beginning because when we took in my granddaughter, we received $17 a month. But then when we started foster care, they were getting like $500 a month. So it's very alarming to realize that the child being with the family and being supported by the family is not really being supported through the state.
Yeah, thank you. I think it's such an important point. Thanks so much, Victoria. Great. Well, we will keep moving here and we'll look to your questions soon. So I think that Victoria really highlighted some of the key challenges, but I'll just reflect a bit more on them. Certainly limited financial assistance is a huge issue for families, and I'll flag just the disparities in that in a minute. The legal relationship, so often children come into relative care informally, and the relative may not have a formal legal relationship with the child. And that really presents some challenges with accessing benefits, with having the authority to make decisions on behalf of the child, and a whole range of issues. So there's often a need for legal supports and legal services. Related to that, if they don't have legal custody or a legal relationship to the child, they often don't have permission to consent to health care or education. So enrolling in school can be a challenge, having access to medical records to be able to enroll the children in school. So there are some things like consent laws that can help with that if legal custody isn't an option immediately. Or isn't an appropriate option. Affordable housing is a huge issue. Often these families were living in housing that may be senior housing, not designed for children, or there may be limitations on whether children can live there, but all of a sudden they need larger units or places that are appropriate for children to be with them. And then the children often come with trauma. Often there's, a real issue that has led to the children not be able to remain with their parents. So we have children that have experienced living with a parent that have had really severe mental health challenges, substance use, among other things. So they're coming into this family really bringing a lot of challenges with them. And coming to a relative reduces trauma, but it also means that they come with some real issues. So we need to be supporting the relative in that way. And then caregivers are facing challenges too. They weren't planning on this, so there's a financial issue, but there's also often a feeling of isolation. Excuse me. They may be socially isolated from peers now and be experiencing grief about the loss that may come from a relationship with a family member to the loss of what they were expecting for their retirement. Pardon me. Just a brief few moments about the impact of COVID-19 on grand families. We did, in collaboration with the GROW Grand Families Outcome Working Group and Collaborative Solutions, did a survey back in June about the impact of COVID-19, and we really saw that there are huge impacts on grand families. We're doing another one of these surveys now, so we'll have some updated data soon, but 38% were unable to pay or worried about paying a mortgage or rent. 43% were afraid to leave the home, and then 32% went to food sites, and once they got there, they ran out of food and they had to come back the next day. We also, back to the legal authority issue, have many caregivers that don't have a legal plan for the children, let alone any plan in some cases, or a legal plan or any plan at all. And we saw that 30% did not have a caregiving plan if the caregivers were to die. So that means that those children are, the next stop is foster care for them. And in some cases, they just need some support to help with thinking through a plan and then to make the legal arrangements that are needed. The other pieces highlighted on the screen, respite care was huge. Of course, online education and financial assistance were also just enormous issues for the families. We have a report that highlights the challenges. So if you're interested in learning more, you can find that report at our website here. And I'm going to turn it over then to Bet next to talk about her own situation and reflect a little bit perhaps about the impact of COVID-19. And I recognize Bet has her own family members in the home with her. She's looking at right now.
Yeah, I'm panicking because they just
Okay, we're going to give Bet 1 minute this is our reality, right? Everybody has these realities, and Bet juggles so much. There's something about how children know the moment you're going to talk and they demand your attention. So I'm going to just perhaps keep going, and we can circle back to Bet when she's ready. So take your time, Bet, no worries. A bit more on financial supports while we're waiting for Bet. In terms of what options are available for relatives, we see a couple of sources. Oh, Bet's back.
I apologize.
No worries.
It's just transition from kindergarten to home. And so they're going to make lots of noise in the background, and I'm going to hopefully be able to get through what I wanted to say. Thank you so much for this opportunity. I really appreciate it. And I don't think that there's enough that can be said for spreading the word and getting the issues hopefully before the public in any way. So my story, as it indicates, my name is Bet Hoxie, and I was a foster parent since 1971 until 1997. So I had many children in state's custody go through my home, and over the course of those years, I adopted 8 children. In addition, I have 3 birth children, and I have 10 former foster children that were never freed for adoption, but they still consider me their mom, and this home, their home. I have many grandchildren and a growing number of great-grandchildren. So my household is always busy and, for the most part, filled with lots of love. So I fast forward to 1997, and my husband died. And I still had 6 minor children yet to raise. That was a feat that I hadn't planned, something I hadn't planned on. And each one of those children were born with significant special needs, including 4 that had significant fetal alcohol spectrum disorder, and physical and mental health challenges, just to kind of paint the picture of how I could get to where I am today. Shortly after, Joe died in September, and in November, a group of foster and adoptive parents whom I had worked with in another organization approached me about the possibility of starting a new organization that would cater not just to foster parents, which is what I had done before, but to adoptive. I welcomed that opportunity for two reasons. Number one, I needed to be financially more secure than I was on my husband's Social Security. And secondly, because I really felt there was a real need, not just to meet the needs of foster and adoptive families, because more and more of our foster families were adopting, but because during the course of the organization, of working with the organization that just worked with foster families, I heard from grandfamilies over and over again. The kids, their children would have dropped the grandkids off at their home and then just disappeared. And they had no financial support, no emotional support, and no way of becoming more educationally, having educational research shared with them about what their options were. So we were fortunate enough to start the organization. And for 2 years, we had no funding at all. So it was in the attic of my home. And I had one telephone, private line, and an answering machine. And that was basically how we reached out and met needs of families. And we had quite a number then, but believe me, it grew from probably 120 in that first year to 5,000 that we now work with today. So the new organization became Adoptive and Foster Families of Maine and the Kinship Program. I had no more than started working as the executive director for that organization with actual funding from the Department of Health and Human Services when I became a kinship caregiver for my now almost 22-year-old grandson. So for the first 2 years, I had a playpen in my office because I really couldn't afford to pay for childcare, but we managed. And then time went by, he was able to get into daycare, and we moved forward. Both of his parents are mentally ill. Excuse me again.
We'll just give that a moment.
Did we say something about a time limit?
Go ahead.
Sorry. So I moved forward. Fast forward now to 2015. I've been executive director now for several years for the organization, working 8 to 4:30 every day, and we were doing pretty well. And lo and behold, one of my adopted sons, who suffered from addiction, died of an accidental overdose of drugs. And at that time, I met his sister, half-sister, whom I had really not known over the course of raising her sibling. And she told me at that time that she was pregnant. She was also addicted and needed some help. Within a few months, she gave birth in July, and within a few months, the department was involved. She and her husband approached me, asked me would I take guardianship of him, and he was 14 months by the time I took legal guardianship. He's now 5, and he doesn't really remember any other home. His mom still struggles. His dad's doing really, really well. But I still wonder, what will happen to him? So here I start with some of my concerns. And COVID brought it really to the forefront, but it's always been there, nagging at me. I'm now nearly 75 and raising a 5-year-old. And he has his challenges too, which is not the least of which is opening the door and coming in behind me. So anyway, let me just back up a little bit. So at 72, I decided I would retire. And this is what I didn't share. So I retired at 72, and then lo and behold, another grandchild joined my home. And this time I had to be licensed as a foster parent because she came into the care of the department before I could intervene in any meaningful way. So then I became a licensed foster parent and had, at that time, she was 2 and he was 3. It took me a while, but I finally was able to get her into a daycare and him into a specialized preschool program. And suddenly I realized, oh my goodness, I've been getting up and out the door by 7:30 every day for the last 20 years. And now they're off to school. What do I do with my time? So, sorry, this is part of what I do. Honey, please. A job came available as a kinship specialist at my former adoptive and foster families of Maine. So I took that position and moved through it very quickly, working with the families that I most love and have so much in common with. And then I realized that it was also pretty essential because I had 2 small kids, along with a household. I haven't even talked to you about what the household looks like yet. And realized that I really needed more than just even then my own Social Security to get by on. And I did have foster care for my granddaughter, but it still wasn't enough. The other thing was I have a multi-generational home. It's my home. My daughter, her husband, their 2 kids reside here. And I have a 27-year-old son that I adopted with special needs, for whom I have guardianship. And my grandson, again, who's nearly 22, he still resides here. He does work, and so does my son-in-law. But then it brings a new challenge. First off, this is a very old house, and it's constantly needing repairs. And frankly, no one really knows how to do it, so everything is an expense. And I'm talking about myself, but I'm really giving you a picture of what it's like for everyone that's doing this type of work on a fixed income, because it is difficult and everyone's homes need repair. The older they are, the more difficult it is. And there's been times when I've thought, wow, I would really love to have a smaller, newer home, but that wouldn't work because we're basically a family of 11 and you can't get a very good home that fits that number of people. So that gives you at least a bird's eye view of the kinds of things I've experienced. Additionally, I've discovered from the families that I work with, and they're all kinship caregivers, since COVID, there are more challenges. Trying to get medical attention has been difficult. Trying to get food. I mean, families are home now almost every day and they eat. They eat all the time. So grocery bills are incredible. Water, lights, heat, everything is going 24/7 as opposed to like from the time that you get up in the morning until you leave for work and then back again after 4:30 or 5 o'clock in the evening. That just isn't the case anymore. So many of the families that I work with struggle with that. Something that's occurred several times with families that I work with is that, and this sounds strange, but their septic systems have needed to be repaired or cleaned much more frequently because they're being overused a lot. Hey, honey. Okay, I'm sorry, I'm constantly being distracted. Also, another challenge for me and for others that do not have foster care for their child or the children in their care. If you're not biologically related, you don't qualify for even temporary age and needy families or child-specific TANF. And main care in my state is a challenge. So twice they've hit my 5-year-old's main care off, having lost the paperwork after I'd submitted it. So on those occasions, I've had to pay for his office appointments and his prescriptions. So what I did was, because I have a really good insurance plan, and it's costing me, but I added him to it so I'd never be without him having that kind of backup again, he does have main care right now, but just in case he doesn't, he's covered by my insurance. And I really feel like I've skipped around a lot. I probably used more time than I planned, but that's my story, and I am very open to any kind of questions and so forth. And thank you.
Thank you so much, Beth. That was just an illustration of what I know you juggle every day. So I so appreciate you doing that and articulating so clearly your experience in the midst of juggling little ones. So thank you. We did have a moment. I stopped sharing my screen for a moment because we wanted to just see if we had any questions so far. If not, we can keep moving and ask again at the end, but just wanted to pause to see if you have questions, particularly questions for Bet or Victoria. I see some affirmations about sharing your story and thank yous. Does anybody had any questions so far? Okay, I don't see, oh, yeah, no questions, but I really appreciate the remarks we're hearing. So that's great. Thank you. Well, then we will continue with the presentation and have a chance again later to check back in. And remember to be thinking about those questions that I asked you all to consider at the beginning of the presentation. What's most compelling? What stood out to you? And I'll put those questions up again at the end. All right, if it would let me move forward, there we go. Okay, so I know that both Ms. Bet and Ms. Victoria highlighted some financial challenges that they faced as grand family caregivers. I'm going to dig in a little bit more about what's available in terms of financial support and some of the challenges that we've seen. As always, many of these vary by state, but we'll just do a bit of an overview. So for many, beyond Social Security, one of the most consistently available sources of support across the country for grand families is temporary assistance for needy families. Now, what that looks like varies state by state. But generally what we see, family grants are less likely to be ones that are accessed by grand families. Those you generally consider caregiver income and assets in many cases. So if a family has actually saved for retirement, they may not qualify. However, child-only grants are an option that in most cases do not take the caregiver income into consideration. So that's a positive that many grand families will qualify, but the amount is much smaller than other TANF and way smaller than the foster care payment. We also find that the application process can be complex. They are often combined with other applications that require sharing family income. And so sometimes relatives aren't comfortable with that. And the huge issue is that generally then to apply and get the support, the relative has to assign the child support collection authority to the state, and then the state goes after the parents for child support. And then what happens is that in some cases, then the parent will come back and try to take the child. And so there's some concern about that. So the relatives don't want to apply, or they just don't want the state to go after the parent because the parent may be working really hard to get things back together, and going after for child support really makes things even more difficult for them. So those are some of the challenges with TANF. In terms of foster care maintenance payments, as I mentioned, that's a much higher amount, but it does require system involvement. It requires an extensive licensure process, which can be quite complex. There's a lot of things I know that Bet has talked about, the requirement of recess windows, right, in Maine, that are really hard to meet those requirements, expensive. So many times relatives just, are not able to meet the requirements, or it's such a cumbersome process that they don't, or they're not given information. Many cases from the child welfare system that they could become licensed foster parents. This depends a great deal on state, but they aren't given information, or they're given the information, but they're not really given it in a way that makes clear what they're losing by not electing to become a licensed foster parent. If you don't do this, you will not get the following benefits. So they just may have a hesitation or distrust of the system and not want to pursue that without having the whole picture. So when you look at the comparison of getting the TANF versus the licensing, there is a big difference, and it gets more and more increased as as you have more and more children. So this is national averages. You'll see that for outside the system, national average is $249 a month for a child versus a licensed foster parent at $511. But then when you go to the next level, it doubles to 2 children for the foster parent, and it just goes up incrementally for 2 children for TANF. And then again at 3 children, you're going to see it, just about triple versus another incremental increase. So when you have multiple children, this is huge amounts of money. It is really a big difference for one child, but it really becomes huge amounts with multiple children. And so many relatives just are not given that information. I'll add to that when you go to permanency, when kids leave foster care to guardianship or adoption, in states that have guardianship, not all do, but many do, then you get to continue to keep that payment when kids leave foster care. So that is a long-term benefit that sticks with the child. So it's not just for the period of time they're in foster care. Of course, I know this audience is particularly familiar with Social Security. There are some limitations on access to benefits, particularly for those that are raised by relatives versus grandparents. Relatives that aren't their legal guardians face a lot of challenges. And so there's some issues with accessing Social Security child benefits in particular. Many children and grandfamilies may benefit from the Social Security the caregiver gets as part of the family income, but access to that child benefit can be a real challenge. Food and nutrition supports, the Supplemental Nutrition Assistance Program counts caregiver income, and there we see some real challenges with accessing to that. And then free and reduced school meals also have some barriers around accessing that program for children who are not in foster care. And certainly right now with COVID, there's a whole set of challenges because that's where a lot of the food was coming from at school, and now the kids are home and the grocery bills are really going up. And there are some options to help access that food, but they've been very confusing, hard to access, and sometimes require leaving the home, which is really hard for the families. Healthcare, big issues around just getting accurate information and navigation. And then I mentioned earlier the need to do healthcare consent, to have the legal authority to consent or to enroll the children in various programs or access the information that they need about their healthcare. I talked a bit about housing, and then of course energy assistance can be a real challenge also. And as Bette pointed out, there is a higher demand during COVID on access on energy in general in the home. I do want to flag that a resource that is available and growing for grandfamilies is Kinship Navigator programs. There's some new federal support for these programs. We're working really hard to make sure that that money actually gets to the families. But the idea is those are information and referral programs that help connect families to services. I know that Victoria has a nonprofit that she didn't really go into called Gray Nickel that does some really amazing Kinship Navigator type of work that's fabulous and much more detailed than many state programs do, but want to just acknowledge that we've seen that peer-to-peer supports on Kinship Navigator programs are especially effective because of trust and just the commitment of those peer-to-peer navigators. If you've been through it yourself, you're going to go the extra mile for that other person. And then just before we wrap up, a few things on resources. All of Generations United's Grandfamilies content and more is available at grandfamilies.org. This website, which is a collaboration between us and Casey Family Programs and the American Bar Association Center on the Children and the Law. And this has a lot of state-specific information that you can search here, different topic areas. So we really encourage you to go there if you're looking for that information. We also have state-specific fact sheets. We are in the process of updating these, but they have data on the number of grandfamilies, caregivers, and children in each state and programs in each state to help the families. Those are at that website as well. And then just a snapshot of a couple of relevant resources that are particularly popular and many that have to do with economic security. We have our annual State of Grandfamilies reports. I flagged for you the most recent one, which is on the impact of COVID-19, but those are linked from this PowerPoint. We've also recently, last summer, released some toolkits that specifically focus on providing culturally appropriate services resources to two populations that are overrepresented within grand families. So we have one toolkit for serving African American grand families and one toolkit focused on serving American Indian and Alaska Native grand families. So those are available. We have a number of resources around accessing Social Security, focusing specifically on different children's benefits and also specifically on what's available for grand families. And then I mentioned some of the TANF issues. We have a brief that talks about different TANF trends and practices, and also a fact sheet with tips for how to access TANF. And that one's geared more towards the caregivers. The first one is more towards professionals and advocates, and the second one is geared more towards helping caregivers access benefits. And then finally, I just want to mention that as a result of some federal legislation, a federal council to support grandparents and other relatives raising children was created. And that council was created by law in 2018, had its first meeting in August of 2019, and has been meeting virtually since then. That council is charged with putting together a report to Congress. I co-chair the council and Beth serves on it. And we always, as we give input into the work of the council, really listen to our grand network. And there's all kinds of opportunities for public input. So if you're interested in that, you can go to acl.gov. Actually /SGRG will take you there directly, and you can learn more about the work of that council. And I'll just close with a quote from one of our Grand Network members that I think just so well talks about the impact of COVID-19 and the balance of the challenges and the joy that come with being a grand family. My biggest fear is my health, if I will be around to raise them until they're grown. But my joy is that I get a chance to be with my grandchildren 24/7. They bring a lot of life to me. That's from Cassandra Gentry, who is here in DC. And this is our contact information. And then I'm going to just share my screen again to just remind you of the questions that we asked. I think we have a few minutes for question and discussion. So if you don't have a question, I invite you to think about just sharing your response to one of these. What most surprised you? What stood out as a strength? What strikes you as most compelling and really inspires you to act? So I'm going to stop sharing my screen and invite you to drop your thoughts in the chat or any questions that you have in the chat.
I just want to say thank you very much for this presentation. My name is Bethany Lilly. I work at the ARC of the United States to represent people with intellectual and developmental disabilities. And I think there's a lot of overlap among grandparent caregivers and children with disabilities. And I was really excited that this session was happening, and thank you. I don't know that I have any brilliant ideas beyond, thinking that we need to coordinate a little bit more than maybe we already are on this particular issue. So thank you.
Wonderful. Thank you, Bethany.
I actually have a quick question. I know you talked a little bit about some of the navigator programs that have been kind of rolling out since federal support. Kind of what is the status of those, like across different states, like where those are in like development? I know that there's like the area agencies on aging. Is that kind of the model that was thought of with those navigator programs?
So actually the funding for those programs flows through the Title IV-E agency, which is the agency that is generally responsible for the foster care program. And that's not an ideal way for the dollars to flow, but it is the way that advocacy was able to secure the funds. So that's where the funds flow. And then that agency can contract with a local provider to provide the navigation supports. And in some cases, they are working closely with an aging services provider. So it really depends on the state. States started getting a chunk of that money in 2018, and they've gotten some funds appropriated in each year since. The idea, it's not a ton, it's $19 million flows out to states, tribes, and territories. So when that breaks down, it's not a ton of money, but it's, something to do something with. And states are really using those dollars. The goal is to get programs up and running that are evidence-based, because if they meet a certain standard, then the federal government will reimburse them ongoing into the future at 50% of what their outcomes are. So that's a long answer to say it depends on the state. There's some states that have really robust programs that have been operating for a long time and caregivers feel really excited about them. There are other states where caregivers are like, I know I got the state money, what are they doing? It's like, well, they're still up and running, or they're only running in one county, or they're only serving this population. So it varies significantly. And as advocates, we're trying to get them to reach as many families as possible. Any other reflections or questions? Drop in the chat or turn on your sound. It's like, Barbara, maybe you're going to comment?
Yeah, there was a lot of discussion about love, which was heard so many times. It's not usual to have love front and center in a policy research conference. So I appreciate getting the stories, and we really love hearing from people's real life experiences. And this conference is a real switch for us, from just, academic reports and research to now listen to people. And it's going to really inform our campaign going forward and how I think we operate and what we anticipate as outcomes. And just to connect to people, I think it's very satisfying for me, and I think for many of our staff too, is to hear those stories and know what's happening. And it'll inform, I think, us going forward and thinking about things in new ways, which we really need. It's just really been a transformative time this past year. And if we don't change things now, when will we?
Thank you, Barbara.
I just wanted to thank everybody. This was a really great session. I work at Kids Count in Michigan, and so it was really great to know of the data that you all have, and it's made available, but the stories definitely were the most compelling. And we find that, with our work in Kids Count in Michigan too, the stories really help to drive change. So thanks. And one other thing that stood out is even how, programs like Medicare and Social Security that are so important, they could do even more to support families. So thanks so much.
Thank you, Parker. Yeah, and I just want to acknowledge that we have really amazing brains that have intimate knowledge of these programs like Medicare and Social Security. So one of the joys of Generations United is to bring together those researchers and experts with real life experiences. So I just, offer us up as a resource to, if you have questions and want to hear directly from somebody with that experience, that is the gift of the network. And we work really hard to provide support to those family voices. We recognize that it takes time out of really busy people's lives to bring Victoria and Bet and others like them to conversations like this. And so we are here to bridge and also try to provide the support that's needed, recognizing the time it takes. So feel free to reach out. You can, I did share information with Bet and Victoria, but we just want to acknowledge that we want to provide, full support and recognition of their time if you're interested in speaking with them further.
Do you do outreach to communities? How do people find out about you? What kind of outreach do you do? Sorry.
Sure. So, I think we're increasingly now we have outreach lists. We do presentations at various conferences to different audiences. We do a lot of technical assistance out, particularly to child welfare agencies and aging community agencies. So I think that's a big part of our outreach. But in addition to that, our Grand Voices Network is really well connected in states, and so they know where the people are. And so we, try to share our resources, and then those networks share our information and resources with their people, and vice versa. We hope that they will, bring questions to us, and that we can help them with any questions that are out in the field. Yeah. Well, I think I don't see any other questions in the chat. I want to just say thank you again to Bet and Victoria for sharing your story, and for this audience. It's tricky when you can't always see people, but it's wonderful to see your face pop up during the question times and know you're listening and engaged.